Welcome to Field Notes, an exploration of functional medicine. I'm Rob Downey, a family practice MD and Institute for Functional Medicine certified practitioner. I'm coming to you from Seaworthy Functional Medicine in Homer, Alaska. Seaworthy exists to help people overcome their health challenges and be fully vital. Today we are fortunate enough to be joined by Dr. Steven Masley, an MD physician, a nutritionist, trained chef, PBS program host, fellow the American Heart Association and the American College of Nutrition, author of the best-selling book, The 30-Day Heart Tune-Up, and a thought leader in functional medicine who's been seen by millions on Disney, PBS, and Discovery. So, Steven, thank you so much for giving us your time today. What a privilege to get to talk to you.
Hey, Rob, it's great to be with you. I'm really delighted.
This area is really worth a tune-up for me and the audience because my training getting certified by Institute for Functional Medicine included Mark Houston and Mimi Garneri and references to Dean Ornish's reversal of cholesterol plaques. And now all of us who are part of today's podcast will get to be caught up by you on the leading edge of this. And I just have a whole bunch of questions that I think our audience would be interested in. So
great.
It's super exciting. I can't resist asking you, though, I have it on authority that you've spent some recent time sailing in the Caribbean, and I presume that's good for one's heart?
Yeah, well, we spent 3 summers in the Mediterranean looking at lifestyle and how, why is that the longest living place on the planet to be? And why is the food so the food is fantastic. It's definitely not a myth. So we have 3 summers there. And then we wanted to check out some of the Caribbean, surprisingly, has some islands with the longest lived people on the planet. Those, I should say, the most centenarians who live more than 100 years of age. So
the sort of blue zone idea, right? These blue zones have a lot to teach us.
Yeah, and I didn't realize until recently that there are literally some blue zones in the Caribbean islands as well. So, it's not just the top blue zones that we hear about. There's some other ones that I was really excited to take a look at up close from a sailboat. So the rumor is true. It was great.
What a privilege and a blessing to learn and teach and have it all probably in the fabric of joy and exploration, I would think. Being in Greece, eating well did not feel like work. When I got to be in Greece with my daughter last summer, it felt like, no, it was 2 years ago, pardon me. It just was sheer magic sitting down next to the sea in Greece and eating a meal that was prepared locally.
Real food, I think that's what it comes down to, eating real basic food, without packaging or processing or chemicals. And it tastes fantastic.
Yeah. Institute for Functional Medicine at the annual international conference a couple of years ago had a food leader in California who worked with the Culinary Institute of America. And this deliciousness principle was critical. And as I've reviewed your work to get ready for today, one of the sort of myths to break is that people are going to suffer to get well. It's the inverse of what we want for them. We want them to form these food friendships. Is that an accurate way to characterize it?
I like that, food friendships. Yeah, I like to point out foods that are really healthy that you might like so you can enjoy the food and eat it more often. That's really a key. Instead of focusing on what you can't have, let's focus on things that are really good for you and healthy and try to eat them more often. That's a lot easier for people to do. And I think it's taken me a long time to realize easy is critical. If we give people something that's easy to do, tastes fantastic, they can find the ingredients at their local grocery store, or if you're in Alaska, you can go out and catch them.
Yeah, right on.
To being successful and making changes.
Yeah. Well, I'm getting a little ahead of myself. So for our audience's benefit, the number one killer of folks in the Western world, the United States, is heart disease. And we know that 90% of it is preventable. So why aren't we there yet?
So, I mean, that's a really important question. As you said, we can prevent 90% of heart disease with just lifestyle without any drugs, yet it's still the #1 killer of men and women. And I think there's two primary problems. One is our healthcare system, that we really focus on end-stage disease. 90% of all healthcare spending for heart disease goes to procedures and hospital care, which usually do not extend life. They certainly don't extend necessarily quality of life, but they actually don't prevent death. They're, treating symptoms at the very end of life phase. And secondly, I think we as providers and health educators have given too many confusing messages, and people are kind of paralyzed as what to do. We've got all of these controversial and conflicting recommendations. And I think what we need to do is focus on what's really effective, what can people do, and simple steps they can make that make a huge difference. And we got to get back to basics.
Thank you. Thank you. Well, so with this theme then of forming food friendships and having things be simple, which you and I have both arrived at a point in our career where perhaps it comes into focus. I'm always fascinated by this idea from Malcolm Gladwell's book, Blink, that after we do something for 10,000 hours, the aha moments start coming faster and they're often simpler. So there's a distillation that happens when people do things. And I think sometimes some of our most effective work is after we pass the 10,000 hour mark. So I've noticed that I'll have people, if their breakfast isn't healthy, I'll just ask them, well, do you want to try to make chia pudding? It's 5 minutes, 7 servings, blueberries, chia seeds, non-dairy milk, a little vanilla, honey, a little raw honey if you need it. And they just feel like, you got to be kidding me. This is my start. And it feels doable to them, I guess. So you've got 5 new foods you want people to recognize as heart critical. Is that accurate,
Yes.
Steve?
I think there are 5 things we really need to focus on. And first would be colorful fiber sources. That's vegetable, fruit, beans, nuts. I mean, those are the pigments that protect our body from rusting on the inside from oxidation. They block inflammation. They promote health. They make our arteries dilate. They improve brain speed. I mean, so #1 is we need to eat a lot more vegetable, fruit, beans, and nuts that are colorful than the average American typically eats. The second would be healthy fats. I mean, we were on a low-fat craze for quite some time, and I think that's actually associated with accelerated cognitive decline. I don't see any. I think what's really important is that we add smart fats. It's not all fat, it's smart fats. It's like wild salmon and extra virgin olive oil and more nuts, and using nut oils to cook with, like almond oil and avocado oil, along with extra virgin olive oil for our cooking oils. Dark chocolate is another, great dark. So dark fat, smart fat. So colorful pigments that have fiber, the fats, and then protein, which needs to be clean. Maybe in Alaska, you do better at getting clean protein, but far too many people are focused on food that comes from a feedlot that's been enriched with pesticides and hormones and herbicides, and it's pretty toxic. So it not only does it cause cancer, we know it increases your dementia risk about 300%. So clean protein that, it's cage-free, it's organic, it's wild seafood, it's beans, some organic dairy, things that are clean. The fourth would be beverages that nourish us rather than make us fat. I mean, there's way too much sugar and artificial sweeteners in American beverages today. So clean water, I'm herbal teas and infusions, red wine. I'm good with tea and coffee and wine as long as they're moderation, and enjoying them and looking at the quality, but mostly getting away from sugar and sweeteners in drinks. And last would be a probiotic source. I think there's really new compelling information that our gut microbiome is a bigger risk factor for heart disease than cholesterol levels are. So we really need to nourish our gut. And the two things we need are fiber, because that's what that bacteria feeds on, is the fiber in the gut, and probiotics that could come from sauerkraut, or if you're not dairy intolerant, then yogurt or kefir in an organic source, or many of the other probiotic sources that are out there, and pickled vegetables and kimchi, and there's so many. I think probiotics are really an important thing to add. And I think it's really recent that we're thinking about adding them for your heart.
Seems like all roads the last 10 years lead to the gut. So if somebody were to ask you, well, how does the gut help the heart? Is because it's quenching silent inflammation? Are the probiotics beneficially immunomodulatory? What's the mechanism?
Well, yes and yes. Plus, they definitely do those have some physiologic features. If probiotics lower inflammatory levels, they help insulin sensitivity, but they impact all the risk factors for heart disease. The right probiotics have been shown in randomized clinical trials to lower blood pressure, to improve cholesterol profiles, to help us lose weight. They, as I said, lower inflammation. They lower blood sugar levels. So all those critical risk factors are associated with heart disease. But more recently, we've realized that bad gut microbes produce a compound called trimethylamine oxide, TMAO. And if your TMAO levels are high, that increases your risk for heart disease by 62%. In contrast, if your cholesterol levels are high, that increases your risk for heart disease by about 24%. So it's not quite triple, but it's more than double the risk of your cholesterol if you have bacteria, the bad bacteria that grow. These are now, and there's a couple, a Mediterranean diet really lowers TMAO levels, following that eating profile. I think the worst scenario would be to eat a lot of red meat and sugar and refined carbs. That's the worst diet for promoting TMAO levels. So,
the unholy trinity.
But I mean, there's a lot we can do that makes a huge difference. And we know when you're helping your gut, you're helping your quality of life, not just I think originally, I started with, functional medicine back in the early 1990s. So long time ago when it was first starting, I went to their second annual meeting. And
that's cool.
We talked about the gut was important for gut symptoms. Later, we realized it was like the second brain, and impacted memory and brain function. And then we realized it had to do with weight control. But I think the latest evidence is it's a very strong predictor of heart disease as well. It's like the missing risk factor for heart disease we've neglected and we need to address. But there's so many other benefits, just as you said, for helping take care of your gut.
Because you're a fellow of the American Heart Association, what do you hear from your colleagues at the AHA about the evolution of risk factors?
That is more of, the American Heart Association group as a whole is pretty conservative, and they have not embraced functional medicine yet in a major way. So I'm like to them, I'm not a naturopath, but they think of me as the natural. And that they'll call me the naturopath in the group, even though I'm an MD physician. So to them, I represent this fringe way, but when I go to medical meetings and I speak to cardiologists and other fellows of the American Heart Association, they appreciate it, they get it, but it's not what they do day in out. They spend 90% of their energy in the hospital and doing procedures. And when I talk about lifestyle, they're like, well, people won't do it if when I tell them to eat healthy, they don't do it. But I'm thinking, you may not give them the resources they need, the help, the support, the ideas, the details. But if you just say eat better, exercise, pat them on the back, and then I'll put you on medication next week when you come back. That's not going to work. We really need to give people tools and recipes so that they can do this and succeed. And they can succeed. I know you believe that. I believe that. Amazing transformations with the right lifestyle changes.
Well, yeah, two things there briefly, just for the benefit of our audience. One is that I always want to focus on compassion for each person and where they see the world from. And I think that cardiology evolved in the hospital, as you noted. And so those heart attacks and intensive care unit type things shape that field. And so it's kind of up to primary care and functional medicine to do a lot of the heavy lifting on the
Yes.
front end. And I also have a lot of colleagues, same thing. They're very interested in the principles. The day-to-day work is kind of a grind and it's a distraction. And so other thing I love is a lot of the stuff from functional medicine emerges in the conventional domain. It's just no longer labeled as such.
Yeah. It's becoming mainstream
Yeah.
step by step.
Yeah. So you mentioned the foods that are associated with promoting heart disease, sugar and red meat and simple carbohydrates. Did I miss one?
Well, the two biggest issues for me, far more than the red meat, are sugar and flour. The
Yeah.
number one cause for heart disease is elevated blood sugars and insulin resistance. The number one cause for memory loss and dementia is insulin resistance and elevated blood sugar. So if we only looked at avoiding one thing, I would get sugar levels down. And I think a lot of people don't realize that table sugar, white flour, and whole grain flour all have the same glycemic load. They cause weight, if you had a bowl of eats, they're going to cause your blood sugar levels to go up equally. So whole grains have more nutrients, but it's just like eating a bowl of sugar when you have whole wheat bread or whole wheat crackers or whole wheat tortillas. And I think most people don't appreciate that. And many people are trying to do the right thing, and they have insulin resistance, and their blood sugar levels are mildly elevated, and they're aging rapidly, and we could really do a lot to help them.
Just to add to that, Stephen, the biggest thing I run into over and over again is the group that identified fat as the villain in heart disease decades ago had so much success in their public education efforts that I spend a lot of time saying, let's focus on the blood sugar, the insulin resistance, et cetera. Let's not make fat a villain and let's switch to healthy fat. And so I suppose it's just worth reiterating that if those lessons aren't learned about the importance of healthy fat, then people can get off track, or they can try to help their heart at the expense of their brain, et cetera. All the Institute for Functional Medicine food plans, they average about a 1-to-2 ratio of the good fats to the other macronutrients, the protein and the complex or slow carbohydrates. Do you want to comment more on healthy fats at all?
We need healthy fat. We need it for our brain. Our brain is mostly fat by weight. So, and if we don't eat it, we're literally, I think, shrinking our brains, which is never a good thing. And we're more inflamed. So to maintain our brain function and lower inflammation, we really need healthy fat. And let's see, how long ago was it? It was more than 20 years. I was the medical director at the Pritikin Longevity Center. I went there because I was hoping we could do a randomized trial looking at adding extra virgin olive oil and more nuts to their eating plan, because it was ultra low fat, but it also it got rid of sugar, it got rid of refined carbs, it got rid of processed food. So there was many good things about it, but I really wanted to test adding healthy fat to it. And I wasn't ever allowed to do that. So basically I had to leave, which I did. But, so I was the preacher of low-fat diets for a while. So and that's what the evidence appeared to be at the time, but we were wrong. We were just plain wrong. So I understand the appeal, but we're looking at that science from the 1970s and 80s, which wasn't very good and actually was quite biased. There was a huge, overwhelming influence from companies that were selling margarine and Crisco back then on the American Heart Association, and they endorsed products that we would never recommend today. So I think we've come a long way, and a low-fat diet is appropriately in the past.
Yeah.
And, I'm not a fan of low carb diets because we still need that pigment. And the only way to get it is from carb sources like vegetable, fruit, beans, and nuts. So we want healthy fat, we want clean protein, and we want healthy, good carbs. We want the best of each of those. We don't want these crazy ratios that don't make any sense.
Nice, nice. And you've got a book about the Mediterranean diet. And so is that where a lot of your patients and devotees end up?
Well, it's the easiest diet to follow. That's so important to me. One, it's been rated by the U.S. World and News Report. Their scientific advisory committee is 3 years in a row has ranked it the Mediterranean diet the top diet on the planet. For your heart, for preventing diabetes, has weight loss benefits, and most importantly, it's the easiest diet to follow. So when you ask someone to do it, they can follow it. We had 70% adherence in randomized clinical studies at our clinic when we used it. You can't get that with any other diet. And it works, and it's delicious, and people like it. So, and you just incorporate some Alaska seafood with it, and it goes great.
Yeah, it is so important. I'm a little embarrassed to realize the points in my career that it just did not occur to me to the degree necessary that these are, I suppose that's the reason this phrase food friendships emerged, because I got to thinking, if somebody's not happy with the friends they're hanging out with, or they're not serving them well, but they just sort of try to push those people away, they sort of bounce back. But when there's these new friendships formed that serve us better, the whole thing kind of auto evolves to spending more time with our new friends and less time with our friends that don't serve us well. It seems like the positive psychology part of this doesn't come easy to a lot of Americans who perhaps have this feeling it has to be hard, or it has to be difficult, there has to be suffering. And so I also find people need to let go of the idea that it has to be hard for them to get well, which is sort of so odd, but also feels kind of obvious too. As I see people be successful, I try to reassure them it's okay to get well, it's okay to be healthy, it's okay to feel great, it's okay for it to feel doable. These are all good signs.
Well, and I want to add to that point because it's a really good point you're making. And I think what many people don't realize is when you do these things, you feel better, you have more energy, you sleep better, your sexual function is better. Circulation provides us with vitality. When we have good circulation, we feel fantastic. And that's really what we're doing to prevent and reverse heart disease. We're trying to improve circulation, and the side effect is vitality, and you feel amazing. So what I'm trying to let people know is if you want to feel fantastic, be amazing, improve your sexual function, sleep better, improve your athletic performance, all those great fun things. The side effect is you're preventing heart disease, diabetes, and memory loss. That's, to me, the real pitch. It's about the quality of life that we're getting, and it makes such a big difference.
Yeah, it sure makes it appealing to get to do this kind of work, doesn't it? Because we get to say to people and, as opposed to or. We get to give people win-win solutions. So the issue of reversibility also is non-intuitive to a lot of Americans and a lot of Westerners who've been fatalistic, that if they start down the road to dementia, they'll get it. If they have early multiple sclerosis, they'll get it. If they have coronary blockages, they will progress. And a lot of my time is spent on plasticity, letting people know some of the best news from functional medicine is reversible traits that have been presumed historically to be irreversible. I think it's really important for our audience to hear from you. I suppose some of this leverages initial work by Dean Ornish around the reversibility of cholesterol plaques and expands on it. Is that accurate or not?
So back in the 1980s, he was I think the first one who documented that you could shrink artery plaque with lifestyle. He saw like a 2 to 4% reduction in artery plaque loads on angiogram if people followed his program. And at the time, I worked in the Pacific Northwest in Olympia, and I was a cholesterol nutrition guru for our health organization at Group Health at the time. And I tried to offer his program to people. So even though it worked, 90% of people wouldn't even consider it. And if they tried it, almost 90% dropped out and couldn't stick with it.
Because it's got like a 5% macronutrient fat ratio, right? There's
Yeah,
no
10%, basically a 10% fat diet. And people didn't feel good. And so, yes, if you stick with it, you might get some results. But I think you got results because you got rid of processed food and sugar, and you meditated and you exercised, and you did eat a lot of vegetable, fruit, beans, and nuts.
Mm-hmm.
But I actually think you improve upon that when you add healthy fat, which is I've shown in my clinic. By taking that kind of diet and adding, a clean diet and adding healthy fat to it, we had better results and people could stick with it. And we've showed and published data from my clinic that we've had hundreds of patients who've shrunk their artery plaque by more than 10%.
Remarkable.
Maintained that over years. That they improved their brain speed, their blood pressure got better, their cholesterol got better, they lost weight, they shrunk their artery plaque. 10% is a 10-year reduction in artery age. So our average patient was literally 10 years younger by trying this program.
Oh, I just want to stop for a moment, and it's one of those linger longer moments. That's awesome. Thank you for what you do.
And we published that, and it's been presented at meetings sponsored by the American Heart Association, American College of Nutrition. So it works. We can do this, and I think it's really. You said it properly. Most Americans don't believe it in their heart that you can reverse heart disease, but with just lifestyle. But you can. And while we did this, we usually stop people's medications. I would never say, throw them away, you don't need them anymore. That's not true. Some people do, some don't. But many people are, when they follow this kind of 30-day heart tune-up program, they're able to get off their meds and have better control without them. And feel better and have better quality of life. That's the key. Not to get rid of the med, but to no longer need it, not to qualify for it, and to keep objectively showing that your arteries are shrinking, your brain speed is improving, and you're getting better without the meds. That's really what we're aiming for.
Right on. I'd like to ask you kind of a technical question so that either it'll sort of confirm some understandings on my part or correct them. So, folks will have to have over a 90% blockage often to be symptomatic, to have heart pain or to fail a treadmill test, but they can have a piece of a cholesterol plaque break off and go downstream at a 50% blockage that they couldn't necessarily feel. And some of people's heart attack and stroke risk has to do with plaque stability, whether pieces are prone to breaking off and going downstream or not. Is there much in the non-drug approaches that you document and research or drug adjunct lifestyle approaches that tells us about plaque stability that would be helpful for people to know?
So, I love this question because this is like one of the key take-home messages I give when I talk to a group of physicians, which I do pretty often. So when you have a 70% blockage, that's what can cause an abnormal stress test. That's about the blockage needed to give you angina when you exert yourself. But if that was the case, you would think doing all these bypass surgeries where they bypass that would have improvements, but it doesn't. We know from autopsy studies that more than 80 to 85% of all heart attacks and strokes occur because a little plaque that's 20 to 40% blocked ruptures. These are like pimples, it's like a little pimple in your artery, a bump. And if they block 20 to 40%, those are the most dangerous plaques. They're not heavily calcified. And like a pimple, they can pop. And when they pop, the chemicals come out and it clots the artery. And that clotting is what causes the vast majority of heart attack, stroke, and cardiac death. So little plaques, you can't treat with a procedure. They're too small to treat. Really, insurance only covers procedures for lesions that are 70% blocked or more. But then those lesions are not causing events. They're only causing symptoms. So we spend 90% of our resources creating procedures that aren't going to ever kill someone, but just they're turning off the fire alarm, basically, and letting the fire smolder in the house and come back.
Remarkable.
That's what we're doing. Instead of putting the fire out by the right food, the right nutrients, the right activity, and stress management. Those are my 4 pillars. Food, the key nutrients that we looked at from our published data, which nutrients predict plaque growth and plaque shrinkage, activity, and stress management. Those are the 4 key pillars. And if you do those things, it's amazing the transformation we see, which I'm sure is what you do in your practice every day.
Right. I've gotten to see reversal in all the domains considered historically irreversible in the lay media, whether it's cholesterol plaque regression or multiple sclerosis plaques shrinking in the brain, or people with early cognitive changes, then reversing them that fit the criteria for minimal cognitive impairment or early dementia. And I'm blown away when I witness it. And the folks that have those things happen, they are taking their lifestyle plan very seriously with great engagement and joy and joie de vivre and grit and persistence. And also then their testing and supplementation tends to work really well when their lifestyle plan's rolling, but the converse never works. If their lifestyle isn't rolling, I don't see the testing and supplementation have much effect.
Well, I mean, at least our data is that statin meds probably slow your demise. If you're growing plaque, they'll slow the progression, but they're probably not going to reverse it unless you embrace the lifestyle. But if you embrace the lifestyle, you may not even need, some people still do, some don't, you know, it's variable, but some people don't even need the medications. If they really embrace the lifestyle fully.
Well, Steven, would you share with us then the critical minerals for the heart?
So when we looked at, you know, from almost 1,000 patient base, and we tracked artery plaque growth, shrinkage, stability over time up to 10 years, we noticed that some minerals had and nutrients had a huge impact. The ones that were most predictive of not growing plaque or shrinking plaque, the top 2 were magnesium, zinc. You know, magnesium helps your blood pressure, helps your blood sugar, helps you relax, helps you sleep. It's good for bowel function. It's not surprising. Zinc is really good for your immune function, but also for your blood sugar control. So again, 2 nutrients that are highly help blood sugar seem to help reduce arterial plaque growth, but also fish oil, vitamin D, vitamin K was a really strong predictor.
Interesting.
Well, you know, because if you don't have vitamin K, you transfer calcium from your bones to your arteries. Your bones weaken and your arteries get calcified. Not good.
No,
So
no.
vitamin K, which comes from green leafy vegetables, and you know, K1 at least, or fermented foods for K2, that's a great source of protecting your arteries too. So those were really our top 5 nutrients. Potassium was helpful as well, but you know, and then fiber, overall fiber intake. You know, those were the nutrients that we published that showed if you went from deficient to optimal, that was more important than lowering your cholesterol in terms of our predictability for shrinking arterial plaque.
Do you think if people are resonating with what we're talking about today, do they need to work with an IFM certified or similar type of practitioner to be able to go to someone and say, I want to know more about my risk factors? Because when people come to me, I'll often get a more stratified cholesterol panel with a LP little a or LDL size, high sensitivity C-reactive protein, homocysteine, genetics on ApoE4 and methylation. How much or how little do people need a provider that resonates with this to deploy some of these?
What you're talking about would be ideal. Ideally, every woman have a functional medicine provider to help guide them.
Yeah.
And as a backup, they might have someone in the hospital if they get hit by a truck or something else. But so I think everybody would benefit from it. But in the reality, if you do the 4 key take-home messages well, you eat the right food, you avoid the sugar and flour, you meet your nutrient needs, you stay active and fit, you manage your stress, you don't really need us so much.
Nice. That's what we want.
Out of work, but
that's what we want. Right on. That's great.
Yes.
My
I'm
dad
trying
was
to make it so people don't need me, as a clinician.
Yeah.
If I give them really good advice, what we do is far less important.
Yeah. I respect that so much. It reminds me of my dad, who was my hero, and he was a dentist in Kalispell, Montana, and he was always trying to put himself out of business, and he was always talking with people about not needing him and what they could do to not need him. And it made him really happy when they didn't.
Right. That's my goal, is, that patients would never need me. But let's be realistic. Some people will do everything right, and there's still like something wrong. And that's, to me, especially, that's when these advanced functional medicine testing is so critical to find some genetic susceptibility to an unusual condition where you've got to do more than just the basics. And so sometimes it's essential, but I think for most people, if they just did the basics right, they'd be in really good shape.
Well, I want to emphasize and underscore that, because that's probably become the predominant message of this podcast, is that it's right there in front of our noses. And sometimes the beauty of simple truths is their accessibility, but sometimes the slipperiness of these principles is that Westerners think that a $20,000 workup at Mayo Clinic is going to get them $20,000 worth of health, but $0 worth of meditation is going to get them $0 worth of heart benefit, which that's not what the science is telling us. But it takes a long time for Westerners and Americans, I think, sometimes to just be blown away how good the news is. It almost feels too good to be true to a lot of people. It doesn't to me anymore, because I witness the outcomes, and then I like so many of us, I do functional medicine for myself. So I'm healthier at 53 than I was at 33 or 43 because of functional medicine and the lifestyle.
Well, it's certainly keeping me going. At 65, I feel great, and I'm going every day, and I get to do everything I want to do. And so how long? My plan to this is, how long can I keep this going? That's what I don't know, but that's my goal, is to stay at 100% of, doing what I want to do as I want to do, and not have limitations, and feel fantastic every day. I think that's what it's about. It's not just living longer, it's expanding our health span and our vitality and our quality of life for decades to come.
Right on. Well, Jeff Bland, the father of functional medicine, who you were hanging out with back at the beginning of this whole affair, at the beginning of the Disease Delusion book, he describes his uncle, who was in his 80s or 90s and had played cards for 4 hours with family a week or two before. And he just said to everybody, he thought that he was near to expiring, and he'd had maybe 1% change in function per decade from 50 to his latter years, and then he passed away in his sleep. And Dr. Bland's argument is that normal aging is very little change each decade, very little loss of function, but we're surrounded by so much morbidity and mortality that's become the new abnormal, that folks become fatalistic that they're going to have big losses every decade. And that's not Dr. Bland's argument. I see it in my practice, I see it in myself. His argument is that isn't normal aging.
No, and here's it creeps up on us. So people are gradually feeling worse starting in their 30s, their 40s, their 50s, and they're used to it. And it's the new standard. It's like most Americans now are overweight. 40% are obese. And by, within the next decade, 10 to 20 years, we're looking at 50% of Americans. That's not normal. It might be average, but it's not normal. Likewise, when you try this, I would say the most common thing my patients say to me, an average American who tries to follow this like heart tune-up program, and what they'll say is, wow, I had forgotten how great I could feel. I had no clue. I felt so terrible until now I feel so much better. And to me, that is like the greatest thanks I've ever heard.
Yeah, me too. Absolutely. Well, Dr. Masley, how do people find you and your information and your resources?
Well, they could certainly go on, visit the website. I've got a blog where I post recipes and health tips at drmasley.com, drmasley.com. So that's the easiest way. The books are available anywhere books are sold. But thank you so much for inviting me. It's been really fun to talk with you, Rob. I've really enjoyed it.
Well, it's been a blast for me too, and I'm glad for the people who are going to be blessed with the information that you provided. So it's a big deal. Have a great rest of your day.
You too. Thank you, everyone.
Seaworthy exists for people to overcome their health challenges and be fully vital. Please consider subscribing, giving us a 5-star review if we've earned it, and going to our website podcast tab for any questions or comments you'd like to share with us. Thanks.